Greetings from Yenepoya, deemed to be university. I will be walking you through Attitude, Ethics and Communication, AETCOM in Dentistry. I am Dr. Rashmi Jain. In this next 45 minutes to about 1 hour, I'll be just sensitizing you to what is the need for teaching attitude, ethics and communication, familiarizing all the faculty with effective teaching learning strategies and assessment tools for AETCOM. Share the experience of implementation of AETCOM in medical undergraduate curriculum. And finally, emphasize the need for faculty development program for dealing with AETCOM. Let's think, what is it that you would expect in a dentist treating your near and dear ones? Are you equipping your students, undergraduates, interns, postgraduates with this skill? Think, one measure which you took as a teacher, which you feel has contributed to developing the above mentioned skill or quality in your student. I'll give you a few seconds to think. Think, is it just the knowledge? What is it that these questions are targeting? I'll tell you something which all of us are aware of. A dental graduate, what does he do? He's a clinician, he's a team leader, he works as a member of the team. He of course needs to be a communicator. He is a professional who needs to be a lifelong learner. Why? Because the world of medicine, the world of dentistry is changing so fast. So this particular dental graduate or an Indian dental graduate, if I may call so, needs to be competent, relevant to India, but be also globally competent. There are three domains when we talk of this. It's cognitive, psychomotor, and affective domain, the heart. What is this affective domain which I am referring to? It refers to things such as attitude, values, feelings, respect, professionalism, and communication. Affective domain, it talks of lot of things. Now let me just take you through what is the importance of ethics for dental students. Ethical principles in dentistry, things such as autonomy, respect, values, things such as confidentiality. These are the basic principles which any dentist student or a practicing dentist would have to know about. Ethical challenges faced by dentists such as resource allocation, doing orthodontic treatment on a particular age group, and so on. Ethics shape professional behavior. Do I need to say anything more about this? Ethical practice, how to deal with these challenges. If I equip my students, they will definitely be better professionals. Ethical dental practice benefits not just the patient but also the dentist. The patients, because it makes them feel better that they are involved in their care, and dentists because that is the satisfaction which you finally get. Communication skill, is that important? Definitely. Effective communication in practice, any healthcare practice, involves skills such as active listening. When a patient is heard, when a patient is involved, he'll definitely be a more compliant patient. Good communication impacts patient satisfaction and treatment outcome, because if they are involved, if I can communicate what I want from my patient, why I am doing a certain treatment, definitely he'll be better oriented and more satisfied to what I am planning for him. It equips the dentist to deal with challenges such as dental anxiety, language barrier, which can be faced in communicating with patients. It gives them those small little tricks, the tips, the basic rules, how to deal with these challenges. Finally, a good communication skill builds patient-dentist relationship and ensures loyalty amongst your patients. We know ethics and communication are important. What is this attitude? Attitude is a learned tendency or readiness to evaluate things or react to some ideas, persons or situations in a certain way, either consciously or unconsciously. When I say attitude, a positive attitude, a good attitude, ethics, communication, knowledge, skills, all of them depends on attitude of the person. So when I say teach attitude, ethics and communication to dental graduates, I am looking at empowering dentists with essential skills for future, improving their professional skills, prompting ethical research and innovation in dentistry, and ultimately improving patient satisfaction in dental clinics. Lots has changed. You have learned it, I have learned it. But things have changed. Times have changed. Students have changed. We have changed. Earlier, ethics, values, attitudes were caught, not taught. It was implied, it was understood that a student has learned. Whether I taught it or not does not matter. It was a part of what is technically called as hidden curriculum, something a student learns without me making an effort to teach him. How? Naturally, they learned from the mentors, the role models, the people they were seeing behind. But today, the world is different. If it's not in the curriculum, it's assumed to be not there. It has to be defined and explicit. If it's explicit, if it's defined, it has to be assessed, because assessment drives learning. So if I do not assess it, it is assumed it's not taught. This particular aspect is true for all health professionals and dentistry. Recently, in 2023 August, National Dental Commission Bill has been passed. Along with that, a draft has been released for Bachelor of Dental Surgery, the regulations governing them. There are a lot of changes which have been brought about or which are proposed to be brought about. In the preamble, there is a mention of AETCOM. The importance of ethical values, empathy, communication skill is underscored by providing an exclusive curriculum time in the form of attitude, ethics and communication module. It mentions that amongst the 24 core subjects, bioethics is one of them, having 2 credit hours and 40 teaching hours. Since there are no prerequisite eligibility, it can be taken anytime during the course. It also is part of an elective module as a foundation elective course, 30 hours, where it is called as AETCOM module. Attitude, ethics, communication, what to teach. The lecture B of this particular document talks about the 51 competencies which are to be taught. 51? Yes, lots and lots and lots of competencies have been mentioned. But if you go through these competencies, you will see all of them are ensuring that a student is able to fulfill his role as a clinician, a leader, a communicator, a lifelong learner and a professional in a better way. If I just list some of the things, these are the things which are related to patient care, communication, ethics, medico-legal issue, social competence, cultural competence, role of dentist in a healthcare system, professionalism, working in a team, an interprofessional team, lifelong learning skill, career development, scholarship. These are just some of the things I have listed out. Basic aim is they have listed out about 51 competencies. The module, the actual teaching is something which the universities will have to develop. When I talk of developing a module, I am talking about what is the content, how you are going to teach the content, how you are going to assess and how is it going to be placed in the curriculum. Let us go through each one of them so we know what we have to be prepared for if we would like to teach AETCOM. Now let's start with how to teach and assess AETCOM. You know, life doesn't come with a manual. They say it comes with a mom. We, the teachers, the dentists come with a National Dental Commission. The physicians, the doctors come with National Medical Commission and they issue guidelines. In medicine, the guidelines have been issued. There's an AETCOM module. Currently for dentistry, as it's still in the draft stage probably, the AETCOM module is not yet being released. Why am I focusing on how to teach AETCOM? When I say skills and knowledge, it's easy because there are clear defined competencies. We know what we need to teach, monitor and evaluate. Things such as interpersonal skills, being a team player, attitude, value, achieving something, motivation, these are a little vague, unclear competency. If the competency is unclear, I, the teacher, am also not sure how I should teach them, monitor or evaluate them. The things which worked very well for skill and knowledge such as lectures, didactic interactive lectures or practicals may not always work when we are talking of AETCOM. When we are talking of AETCOM, we need to focus a little more on experience building, experiential learning, making a student interact with you, making the student learn the basic nitty-gritty, not just in the theory part, but also in living through it. As a result of which, there are several innovative or different teaching methodologies which are proven more effective for teaching AETCOM related skills. Let's see a few of them. Case discussions, Case studies. Case studies are case scenarios or summary. We need to have a scenario defined, discussion points of that, and finally a case study always ends with a take-home message. You can create it yourself or use ready cases. These are just some of the modules which are developed by WHO and various societies. Recently, just a few days back, that is 5th of October 2023, National Medical Commission has come with professional conduct review. They have given a few cases. These cases or case scenarios are to assist the students and professionals in learning about ethics and medical regulations. Role play. Don't we all love it? The moment I say I would like to teach communication skill, the first thought that comes, let's make them do a role play. But role play is not just a play. It has to be planned. It should be clear, simple, uncomplicated scenario. A role play should always follow certain rules. It must have learning objectives. It should have a discussion or a debriefing after the role play. And definitely the role play needs to have a added feedback to give it any educational value. Simulation. The lesser I speak, the more important it is. Simulation is something which no words can define its role in teaching AETCOM. Use of scenario, paper cases, standardized patients are so important in teaching human factors such as teamwork, communication, and so on. When I say simulation, I am not just talking of big scenarios or huge machines. I am talking of the basic skills which are important for any simulation based teaching. In fact, if you go through the competencies, you will notice many of them are intended to be taught in a simulated setting. Books, movies, don't they transport us into an entirely different world? They create a world like no other. They have the power to make us an integral part of the plot. They make us take sides, feel for the characters. What better and useful way of teaching attitude, ethics and communication? Think of any movie, any book which is related to the topic you're planning. These are just some of the examples which are very commonly used to teach these competencies. But remember, when we teach a book or a movie, when we want to show them a clipping or review it, there has to be a content, a context, why I am teaching it, an intent. It's not just a movie show. What is the intention? And always a key message to be taken. Just like books, we can use newspaper clippings as triggers for discussion. Articles, journal clubs, they can all be triggers for discussions on AETCOM related topic. Debates. Taking sides, what better way than debating things out? This is just one of the AETCOM competency mentioned in Annexure B. Debate topics can be related to it because they make you take sides. They make a student think beyond what is given in a textbook. It makes them research and develop their speaking skills, which is so important for being a good communicator. Narratives, stories. Don't we all love stories? What if I tell my story? What if my student tells a story? A story of what happened when he saw a small child having a cleft lip and a cleft palate. A story of an elderly person undergoing a treatment and losing his teeth. These stories help a learner make sense of an event. The narratives can be by the students or we can learn from narratives written and published by other people. Student participation in various activities such as project work, field work, voluntary services, dental camps, quizzes, competition, cultural relevancy. Yes, they are also important because they teach things such as working in a team, working in an interprofessional team, how to be a leader, how to be a follower. So many things which each one of us needs as a health professional, not just being a doctor. Role model and feedback. Whatever I said, the teaching methodologies will not work if I, the teacher, am not a role model. Whatever I teach, I need to imbibe because just like your children, the ones at home, the students in your class learn more from watching you and me rather than the words which we are speaking. So we need to be good role models if we want to be teachers of ethics. Feedback. When I just talk, when I just speak, or when a student just performs and the teacher doesn't give a feedback, it does not have or has lesser educational value. A feedback makes a learning event much more worthwhile. So role model and feedback are an integral part of any teaching session which is taken for the purpose of teaching AETCOM competencies. I have taught it. Do you think my student will learn it? I think they will learn it, but then I can't be sure. I am a teacher. When I am creating a module, I know I need to create an assessment plan. The assessment can be for learning, means I give a feedback and I'm making a student learn because of my assessment. Things such as role play, seminars, reviews, writing narratives, writing reflections. If we use checklists and rubrics, give feedback, then they can help a student learn while he is performing the activities. If I would like to know his knowledge, the basic tips of what is good, what is bad, what are the basic principles, then I can use knowledge domain assessments such as short answer questions, MCQs. Clinical skills or learning communication skills can be done by using OSCEs in simulated environment or a workplace based assessment on a dental chair. Everything I learn, everything I do has to be documented. Documentation of activities is mandatory when we would like to teach AETCOM. Why? Because documentation gives me the learning progress. Documentation is the first step if I'd like to learn to write reflection. This can be done in logbooks or in the form of portfolio. So assessment and documentation would be an integral part of creating any AETCOM module. There are several ways to learn how to do something. One of the ways is to do the mistake yourself, is to create everything de novo. And the other way is to learn from mistakes or best practices of others. A few years back, Medical Commission came up with AETCOM. So, this particular module for teaching attitude, ethics and communication is already existing as being proposed in 2018. This AETCOM module mentions about 5 sections and has 2 annexures. In that it defines the competency. We have about 39 core competencies. Then there are non-core or desirable competencies and about 14 additional desirable to know competencies. These competencies are a guide as to what the student should know. One of the annexures, one of the sections B, second section talks about the learning modules. Each module has got a background. It's got certain competencies which that particular module addresses, the expected highest level, whether it should be knowledge, attitude, whether it should be knows how, what should it be there. The learning experience in which year, how many hours. It also talks about the expected assessment and it provides a list of brief resources. So there are a total of about 27 modules covering over 139 hours. This is how a learning module looks like. So each year these modules go phase wise. So in phase 1 there are about 5 modules, 8 modules in phase 2, 5 modules in phase 3 and 9 modules in phase 3 part 2. The AETCOM topics are competency based. That means they gradually increase in their difficulty level or in their milestone level. So in first year where a student just learns about what it means to be a doctor or a patient. Second year he learns about some simple ethics principle, working in a healthcare team. In third year or phase 3 part 1, he learns about ethics, a little higher level of ethics such as medical error, how to disclose them, what is confidentiality, what is fiduciary duty. In phase 3 part 2, that's the final year component, he learns about the greater medico-legal and ethical challenges, how to deal with death, what is medical negligence, how does a doctor deal with industry. Communication, something which is basic, is a integral part of all the 4 years of this particular AETCOM module. Now, how did we implement AETCOM? Some of the things which were done was, when these competencies were given, specific learning objectives were derived. Once these objectives were derived, content planning was done. That means lesson plans involving appropriate teaching learning strategies. How would I assess them? They were all incorporated in. this particular module, the teaching hours were made a part of the timetable. It was not something we can do it anytime. There was fixed time which was given to teaching of these competencies, which was mentioned in the schedule. Wherever possible, the teaching of AETCOM was aligned and integrated with the subjects taught in MBBS. Then the important part, I cannot do anything as a teacher if I do not have administrative and logistic support. Administrative support starting from National Medical Commission to training which happened at our regional and nodal centers in medical education technology, to creation of committees at the college level such as the curriculum committee, the AETCOM committees, the medical education units which aimed at training and empowering the faculty on teaching these various aspects of AETCOM. Now the important question, who should teach? I should teach, you should teach, or should we hire AETCOM specialist? I personally believe if it's attitude, ethics, communication, I, the teacher, the doctor needs to teach it because it's related to my subject. It's not something which is a separate subject. I need to be trained in it. After all, it's me, it's my subject. That is the point, that is the place where I expect my student to be practicing AETCOM. If he is going to be practicing AETCOM in the context of my subject, how can somebody else teach him? So this is so important. Each one of us needs to be not just a role model, but we need to be empowered and equipped in teaching AETCOM. That brings us to the final and the most important part of AETCOM implementation, the faculty development. Faculty needs to be trained in so many things. If I list just a few, developing competency-based AETCOM module. The module which I just shared is competency-based because it's a vertical module. It's not a standalone module which is implemented only in one part. The module which is proposed by the Dental Commission seems to be a standalone. You need to think, are you okay with that, or would you like it to be a competency based module? This is where your feedback would be important. The teaching strategies, the teachers need to be taught what are these innovative strategies, how to implement them, hand holding needs to be done. Planning of assessment, documentation, all of these need to be planned, devised specific to your context, to your universities. Feedback skills. Of course, I am a teacher. I know how to give feedback. But then, am I trained in it? If not, I need to be trained. Reflection. It's so easy for me to tell a student, write a journal, write a reflection. Have I ever written one? If not, now is the time to start. Because if I don't know the difficulties in writing a journal, in reflecting on an event, on a session, on what I teach, how can I teach it to my student? Simulated settings. The principles of simulation-based teachings are quite interesting, very innovative. They are principles of immersive and experiential learning. We, the teachers, need to be trained into it. If I put it in a nutshell, there needs to be a shift from teachers teaching to students learning. So when I want to conclude about AETCOM, what I would like to say is, sky is the limit. Everything has been laid out. The Commission has given a draft regulation where they have laid out some of the things. It's up to you now to decide. If you can dream it, you can do it. Accept the challenge so that you may feel the exhilaration of victory. The smiles of the children, a perfect communication, ethical practice, attitude, a positive attitude. Those are the rewards you get when you make the teaching of AETCOM explicit and defined rather than just assumed. So thank you for that.